given you have been trying for such a long time, and plus the sperm is an issue, your only bet is IVF.
What tea do you want?
Salad, please.
After almost 6 years of unexplained infertility, we finally know what's been wrong. The years of intense physical pain, fatigue, bowel problems, hair loss, depression, anxiety, bloating, brain fog, and infertility finally has a name, or rather names: endometriosis and hypothyroidism. Here we are at hospital for the 100th millionth time, getting my blood test done. The proof that I've been sticked. I took my blood!
Yeah, another blood test. Another vial. How do you feel?
It's been up and down, to be honest. Like, today I'm feeling like super fatigued and stuff. But
Yeah.
I'm glad that we've got some kind of answers as to why I've been feeling this way for so many years. But yeah, I don't know. It's just quite a shock.
It's good that you've got like measured results
Yeah.
and measured tests, and yeah, you know,
Here we are.
it's tough, but you've done so well with all these tests.
Thanks.
So,
I had a nice woman actually today. She had blue hair.
oh, fun.
And she was telling me about how her and her hairdressers plan to like do the whole rainbow. Purple's her favourite.
Yeah.
They're pretty
Nice.
cool.
Oh, fun.
Maybe I should get purple hair
Yeah, maybe.
for the quarter life crisis.
The endometriosis diagnosis wasn't actually a shock to us. Having done a lot of research about Beth's symptoms over the years, we were aware that endometriosis was a high possibility. That, coupled with a few of our kind subscribers contacting Beth directly via Instagram and recommending she get checked for this. It just took a few years for doctors to finally diagnose it. What really did blindside us was the hypothyroidism diagnosis. It was so challenging trying to comprehend the sheer scale of the challenge in front of us, as both hypothyroidism and endometriosis contribute to infertility. Not to mention my low sperm mobility that we were already aware of. The impact on our mental health was considerable, and it's taken us a while to come to terms with.
The next clip you're about to see is our first appointment with our gynecologist. It was about his findings and his recommendations going forward.
So the uterus, absolutely fine. There are no problems, no concerns, everything is done. Sperms, motility grow. So what I want to do is start taking the supplements, a combination of vitamins, minerals and antioxidants. So to improve semen parameters. So it won't like make it normal, but to a certain extent it will help.
Yeah, okay.
Ovaries, one ovary is a massive problem.
Yeah.
The other ovary, egg count is reasonable, so I'm not worried about that. The right ovary has a chunky cyst, and that is called an endometrioma. So it's a part of endometriosis spectrum. Every woman, when she has a period, some blood goes into your tummy.
Right.
All of you. But we still don't know why you should have endometriosis and she shouldn't. So the women who are prone to develop, so these cells, they will most commonly lodge on the ovary and back of the uterus due to gravity. Then they will stick there and start growing.
Mm.
And then every time you're having a period outside, you have micro bleeding inside.
Right.
And that causes heavy periods, painful intercourse, and all these things. When you release an egg from the ovary, practically there is a little wound because the follicle is open.
Right.
And sometimes these cells, they gain entry inside the ovary.
Mm.
And then they start growing there. So now, not only you're bleeding outside, the blood is collecting
Right.
inside.
Inside the ovary.
That's what is happening.
So you're having a period
Okay.
inside your ovary.
You might have been carrying it for years.
Yeah,
Yeah.
I've had the pain for years and years.
Yeah, and it works at multiple levels. So it eats away your eggs faster. It damages your eggs faster.
Right.
It affects the quality of your eggs. It affects the function of your tubes. And on top, the sperm is an issue.
Yeah.
So you got whole problem in there. The gold standard is surgery, because we are not just going there to see, we are going to clean everything. So we go in, we remove the cyst, strip it off, send it to the lab. Everywhere there is endometriosis, we done it, check your tubes, anything and everything,
Would it come
which
back?
I feel 10 to 15%, but it's slightly different for my patients because majority of my patients are trying to get pregnant, and your endometriosis has a funny relation with your pregnancy, that it will create an obstacle for you to get pregnant, but once you're pregnant, your pregnancy will treat.
How?
Because treatment is shutting your periods down.
Right.
So once you're pregnant for 10 months, there's no period.
Mm.
So endometrium in wrong place or right place doesn't matter. It's dormant. Then if you breastfeed for a year or two, and then it becomes difficult for it to be start from scratch and cause more issues.
I'm not sure if you're already aware on the report, but with Beth hypothyroidism, we've been instructed not to try for the next.
Just until my thyroid, till the hormones are back in balance.
Don't worry.
Because they said that it's a danger to to any fetus that with Beth's high TSH at the moment.
You're getting supplement, and your baby is best parasite in the world. It won't care about you. It will just get everything. Plus, in pregnancy, they will increase your dose.
So you think it's safe to try for a baby?
You can ask them to increase the dose.
Just
Your
to
ovary
check.
is going to need surgery.
Right.
There's no other way.
Yeah.
So we'll fix it. Okay? So I'm going to put you on a waiting list for surgery anyways, because my waiting list is almost 7 months, 6 months. So it's a hysteroscopy, so it's a full MOT. So we bring you in as a day case, put you to sleep, the camera into the uterus, have a good look, camera through your belly button, have a good look, push the thigh, shake the tubes, remove the cyst as much as possible, treat all the visible endometriosis, we burn it with an electric current.
I've heard that there was 2 different types. There was the ablation surgery and then the other type that cuts it out.
No, that's not needed for you. You are trying to get pregnant. So for pregnancy, we want to do as much as necessary. If I keep going in, diving and cutting tissues off and everything, all it will do is it will lead to lots and lots of adhesions that might block your tubes or that might get your ovary stuck, and it doesn't change your fertility outcome anyways. The thing is like, it's apples and pears. Do you want to go in with something and come out with 3 more problems? Or do we go in, get as much as necessary for you to get pregnant and have a baby? So the problem is not doing it.
Yeah.
The problem is why are we doing it? And you can only have one or the two. You can either get pregnant or we can treat your endometriosis to the maximum degree. So to me, removing your cyst, treating all other visible endometriosis and not touching your bowel is going to be helpful.
The bowel issues have been pretty severe for you. Would you be able to see if there's any endometriosis?
We will see, but we won't treat it because bowel treating is not fun. I don't want it to come out and wake up with a colostomy.
Right. There's more risk.
That's what I'm saying.
More risk.
Okay.
Right.
Okay? If you don't want to get pregnant, fine. We'll do it together with bowel surgeons and everything. But then we want to step back. You will consent for colostomy and everything. I'm more interested in getting you pregnant
Yeah.
than sorting that issue at this point in time. You could choose to have IVF with one ovary.
Right.
because the endometrioma ovary won't respond.
That one's kind of out of the question until you take the endometrioma out. Okay. What is kind of your recommendation?
Given you have been trying for such a long time, and plus the sperm is an issue, your only bet is IVF, ICSI basically. Obviously, we never say never because it's not like absent sperms or anything. Another issue is going to be your weight, okay? Because NHS says your BMI has to be below 19. Oh, sorry, above 19, and yours is low. So what I don't want is when the actual time comes, so you need to put on a little weight. Because NHS, because they pay for your treatment, they make the rules. And I had really bad experience. My 3 patients, they got rejected because their BMI was below 19. So meanwhile, I wanted to say, go to McDonald's, have some burgers every day, and put on at least a stone. Because if not, you'll have to pay for IVF. You're looking at around 10,000-11,000 for 1 round.
Okay.
I'm just warning you. Okay, because what I don't want is we do everything, and when the actual time comes, they will check your BMI and say, you can't have it because of that.
Okay.
Okay? So everything is in place.
Thank you.
Well done. You did really well.
Ay, ay, ay.
So I just had our gynae big consultation. Literally just finished it, and we thought we just feeling quite overwhelmed, aren't we?
Starting to go quite quickly now. Booked in for my surgery to get the cyst taken out of my ovary.
Yeah.
It's just quite a chunky cyst, about that big.
4 centimetres. So that's like, So yeah, but you did really well in the scan, internal scan. And it was actually quite interesting to see the x-ray, because he showed it to us in real time. And he showed us the
Did you
cyst.
video that?
I couldn't know, but I got a picture of it, which maybe I can insert. All the doctors were around, and also you were kind of, didn't want to get you in shot in that.
Just with my vag in the air.
But this, the cyst and the 3-dimensional view of Beth's uterus was really interesting. It's a shame that it's so big, but one of the good things is that Beth, the left ovary, is completely fine.
Yeah.
So
Beth has
that's
one good ovary.
So Beth has a good ovary.
And he said my uterus was very photogenic, so obviously that's amazing. He said that I could have a picture for my Instagram.
Yeah, he was very, I mean, obviously he's a doctor, but he was very calm, and he does this all day, so that's probably his job.
Yeah.
But like, he was just so chilled about it all.
It was a bit snappy at points, isn't it?
I think it's just because like he had to just get to the point, and he didn't want to obviously beat around the bush. Like, he's not doing any small talk or anything.
Other than when he was going to put the scan thing up my vagina and started doing a bit of small talk, probably because it's awkward.
Yeah. But I think one of the things that was quite impactful or moving in a bad way, that kind of was like, as he said, it's highly likely that we're going to have IVF, which is something we kind of was a last resort for us. Mainly because, not just because of Beth's of the issues that we've already mentioned, but also because the motility of my sperm was lower than average. And so that, coupled with some of the other issues Beth's facing,
Let alone the hypothyroid.
Yeah, means that it's highly likely that we're going to need IVF.
But we're praying for a miracle, because this is not of God. Like, God does not want this for us at all. Like,
we want to have children naturally, and we've that's always been our priority. It's not that we're going to write off IVF, or it's not about judging other people's decisions. You know, it's nothing to do with anything anyone else is doing. It's just what we believe we want for our life, and we're still going to put that as have that in the forefront of our minds, and look to kind of pursue that. There are obviously things I can do to improve the motility. The surgery that Beth's going to be taking, the hypothyroid medication that we're now on, or that you're now So we. I say we,
It's
like
we're one
the
person.
collective we.
It's
Yeah,
like when
we're
people
on
say
medication.
We're pregnant, but it's like it extends to
Yeah.
everything. We just ate lunch, but in
We,
reality, one of us just ate lunch.
We just went to the toilet. And so now we're back. So that's where we're at. Going forward, we want to focus a lot more on our health and our enjoyment of life, because this journey is hard, and every moment of joy and happiness that we get, we want to grab it with both hands.
We want to say a massive thank you to our subscribers who have supported us so far. We love and appreciate you so much. If you're not already, make sure you subscribe and like this video because it really supports our channel. Say hi in the comments down below and we'll see you in the next video. Bye!